The visiting nurses were present in the 30s here in Cedar Rapids, but they were a very small group. And in 1960, Marion Van Fossen was appointed the director of the visiting nurses, and that's when visiting nurses really grew. A lawyer friend of mine said, Marion Van Fossen, don't let anybody say anything against her chickadees out in public, but she could really blast you in the office. Oh, she was wonderful, though. She was really good.
From my perspective, it's essential to care for people in their homes. The large majority of people tell us that they want to remain in their own homes for as long as possible, and organizations like the VNA, who can start seeing someone even before they leave the hospital potentially, are essential in helping those folks be successful in managing their illnesses, managing their conditions, so they don't have to be re-hospitalized, maybe as soon as they would have otherwise, or even at all.
We're all about the customer, all about making sure they can be comfortable in their home or recover comfortably in their home. With the changes in healthcare and getting people out of the hospital quicker and sooner, it's really a nice place to be able to come home. People recover quicker when they're in their home.
I think as a nurse or as a health professional, one of the main reasons you stay in the health field is you want to help people. And because it's all one-on-one in the home, I think that's what keeps the staff there. It's just so rewarding for them to be able to know that they were the one that was able to keep that patient or help that patient learn something new or provide a procedure such as wound care so they wouldn't have to go to an extended care facility or move in with a relative.
I think that given the healthcare environment today, you have to be passionate about the care you're giving. And I think the staff at VNA are passionate about that. And I think they'll continue to be passionate. And I think that's why the perception of care is so great.
My relationship with VNA is as a funder. They are part of our health area that addresses preventative care to uninsured low-income individuals. So really, our investment with VNA helps people get the care that they need. It's a way to help reduce emergency room usage and also make sure that they're connected with the care that they need.
I love home health. I think that I'm in a situation now where my husband is ill and we have home health and have used palliative care and hospice. And the difference between his care in the hospital, although it's been good, his recovery at home has been tremendous. And I'm very passionate about home health. I think that everybody should have the opportunity to recover in their home versus staying in the hospital.
I had always, even in nursing school, thought that home health is where I wanted to be. I liked the aspect of doing the preventative stuff. And yeah, the seniors have been an interest of mine always. I think we have a lot to learn from them, and sometimes our society doesn't give them the recognition that they need anymore. And I really find them teaching me a lot more sometimes than I'm teaching them.
I think by working in the hospital, the reason I like home care so much is I realized how short a stay that their hospitalization was, that you couldn't possibly do all the teaching that they needed to do to be independent with their cares. And coming into the home, you can do it at their level, at their pace of learning, instead of being on a time clock for how long they can stay in the hospital.
You were teaching. That was the thing. That was the fun part of it. You were always teaching. Whether it was a mother and baby, whether it was an elderly gentleman, whether it was a middle-aged person, you were always teaching in the home or in wherever you were.
It was different for me to get in the homes of people who were poor and didn't have the facilities that most of us take for granted. And I did work 3 years in the county. I did North Linn County, which was a favorite place of mine because it was rural area and I grew up rural. But I found that sometimes the water didn't run as well, or there might not be any, and that they didn't always have the heating of water like we're accustomed to. And so you had to, do the best you could sometimes without the facilities you have in your own home. There was just such a feeling that you were really helping people who needed help and guidance. And that was satisfying.
Since I've been involved on both a personal and professional level, I've always been real impressed by the dedication, the competence, the ability to provide quality services in people's homes, no matter what the conditions might be.
I think the thing about Visiting Nurse Association is we rarely turn anyone away, and that's what I think we're most proud of, is the ability to use county, United Way, state dollars for patients who don't have a third-party payer. And St. Luke's has then collaborated with Visiting Nurse Association on patients that have not had the resources but wanted to come home. And we've done everything possible to make sure that the care they get is the highest quality.
As people live longer and stay in their homes longer, many folks will require the assistance of organizations like the VNA. And I think they've always responded well to community needs. I think the staff and the management team has always been very aware of what's needed in the community, has always stepped up when there has been a need. The flu shots, the hundreds of thousands of flu shots that are given around the county now, that started with VNA many years ago, and I think people have forgotten that. Now you can go to Walgreens or wherever you want to go and get these shots, but that started right here with VNA. And so those are the kinds of things that they'll continue to do in the future as the need arises.
The intelligence and the staff and the caring at St. Luke's can only enhance what we're already providing.
St. Luke's is that so well known in the community and supported and that, and just being able to have that support behind us will allow us to continue giving care.
We've always had a close relationship at the VNA with St. Luke's, but actually becoming a department of the hospital has opened up so many more doors for us, for so many more resources, that it will make our work so much easier. We have resources that we can call on, which we didn't have before, just being a small, not-for-profit home care agency.
When I started, St. Luke's was not that big. Everybody kind of knew everybody, and I really thought St. Luke's was like a little village. It was a lot of fun.
I liked my time very much, and if I were young, I would go back.